Submerged under the current commotion and collision of ideas about healthcare reform was an announcement made in early October 2009 by the American Association for Autism that 1% of the population in the United States suffers from autism or an autistic spectrum disorder. Yet, it begs for focus on what healthcare should be about. The human and caring dimensions of autism and autistic spectrum disorders, as in so many other long-term disorders, impose burdens of coping and remediation not only on children and their families, but also on the emotional, spiritual, social, educational, and rehabilitative services that they require in the short and the long term. How long term will be depends on finding the cause or causes of these disorders and vigorously pursuing their prevention, which, given the enormity of the problems, is a fiscal and social imperative. In the fine research that has already been conducted over the past 2 decades, we know that damage to the nerve circuitry in the brains of autistic children is a consistent finding. What we need to know is the cause or causes of this intrusion on normal development. They can be many, and within the past 15 to 20 years of my 46 years as a pediatrician and over 50 as a physician, I have addressed these possibilities in some depth in my books, articles, and speeches worldwide. My concerns and suggestions have focused on the huge and rapid increase in learning and behavioral disorders in children, which includes autism, autistic spectrum disorders, as well as the escalation of violence. In searching for answers, I have repeatedly tried to engage the attention of healthcare professionals and others to the possibility that the fundamental changes that have occurred in the content of prenatal care over the same period of time in the Western world could be a possible source of this intrusion. In particular, technology associated with the use of high-frequency sound waves could be having a disruptive effect on the developing brain of the fetus. One such procedure used routinely is the ultrasonogram. Following are quotes of my concern taken from some of my books. Quote, "Although recent research has shown routine ultrasonography in pregnancy to be meaningless, that is, meaningless, in terms of immediate pregnancy outcome, it continues to be a part of routine prenatal care. Ultrasonography is carried out at a point in pregnancy when cells are migrating from the notochord, which is the primitive nervous system, to their appointed places in the brain. Since ultrasonography slices through tissue in order to get the image, what, one must ask, is this procedure doing to disturb this orderly migration? And is it causing scrambling and confusion in the pathways of neurotransmission? This and other factors may be interfering with the memories of neural transmission, that is, nerve transmission, to the point of severe dysfunction, particularly as this affects learning, behavior, and emotional stability. Confirmation that in fact this is what is taking place is provided by functional magnetic resonance imaging of the brains of autistic children. Over the past 10 years, there has been extensive research using this modality, from which the accumulating data leaves no doubt whatsoever that autism and autistic spectrum disorders are associated with alterations in nerve circuitry and weaker connectivities between different parts of the brain, all of which, of course, influence function. Disconnections affecting most parts of the brain have been observed and reported, and are associated with several diagnoses in addition to autism and autistic spectrum disorders, for example, pervasive developmental disorder. They would also likely account for at least some of the increase, if not the majority of it, in learning and behavior disorders, which I have described in my books and articles and speeches. However, there appear to be some changes that are specific to autism and autistic spectrum disorder. These include increased brain volume from birth to about 2 to 4 years of age, following which it decreases, so that from approximately 2 to 4 years to 9 to 11 years of age, frontal lobe matter increases only 13% compared to 45% for normal children. That is less than a third. My interpretation of this is that nature, in her ever-present thrust to healing and restoration of function, makes a heroic attempt to make up for the loss and disintegration of nerve cells and their pathways that occurred in utero. But as the demands of development gain momentum, exhaustion sets in, and this compensatory effort can no longer be maintained. Now, this scenario does correlate if you like that pronunciation better, to some degree with the symptoms of regression starting between 2 to 4 years of age in autistic children, the degree of which will depend on the extent of the original damage and the efforts at repair. Of singular importance is the fact that attempts at repair by nature herself start following birth, because it indicates that the damage occurred during pregnancy. This is reinforced by recent research suggesting the damage occurs during pregnancy and probably in the second trimester, in a time frame close to the routine use of ultrasonograms. The convergences here described are too obvious to be ignored, and certainly too obvious to not demand immediate research to establish or disestablish a link between the routine use of ultrasonograms in pregnancy and the subsequent disruption of normal nerve circuitry and brain function in the developing fetus. In doing so, we must also bear in mind differences in the precise window of risk due to variances in individual timing that rests in the broad band of 12 to 20 weeks for migration of the nerve cells, and this is all described in the books that you will see just in a moment. As a final note, routine ultrasonograms are performed to determine the length of gestation and expected date of delivery. When I and other physicians were trained more than 20 years ago, we were taught to do this by manual palpation of the mother's abdomen. And, believe it or not, we were very, very rarely wrong. But consider also the added dimension of healing touch for the mother-to-be, which alas is absent from the use of ultrasonograms. And I hope those of you who have watched this presentation will take it to heart and lobby and push as hard as you can to get the research that we need to establish or disestablish the relationship of ultrasonography to autism, autistic spectrum disorders, and other diagnoses that hamper the development of the child in a society that demands so much of them. Thank you.